When the Bristol-Myers Squibb Children's Hospital at Robert Wood Johnson University Hospital opened to children and families in 2001, it was the realization of a shared vision to build a nationally distinguished academic pediatric health campus that would provide the most innovative and technologically advanced treatment to children and their families close to home. Under the leadership of then-President Harvey Holzberg, Robert Wood Johnson University Hospital had become a transfer destination for many severely ill children from hospitals throughout New Jersey. It was clear that there was a critical need to construct a state-of-the-art, family-centered children's hospital.
There were some exciting techniques used to plan for the Bristol-Myers Squibb Children's Hospital. We went out on the road with the Dean of Robert Wood Johnson Medical School, the hospital president, and nurses and doctors from our staff. We went to the newest children's hospitals in our country, and we looked at the newest facilities. We looked at what worked well and what they thought ought to be changed. The other exciting thing we did is work with a family advisory committee. We had 16 families that helped us plan the children's hospital. That was a first in my career. What a radical idea to work with customers to plan a great new service. The philosophy for the development was to be very patient and family-centered. We treat the entire child and we engage the entire family. That philosophy has now, a decade later, translated to results and outcomes that the families rank the Bristol-Myers Squibb Children's Hospital as the #1 children's hospital in patient satisfaction.
The 105-bed, state-designated acute care children's hospital is a state-of-the-art children's hospital specially designed to address the needs of children of all ages, from fragile newborns to adolescents. Through Bristol-Myers Squibb Children's Hospital and its partners, children and families have access to unparalleled academic and clinical capabilities, including pediatric surgery, urology, cardiology, oncology, hematology, and pulmonology. This unique blend of research and clinical expertise in a family-centered environment attracts thousands of children and their families to Bristol-Myers Squibb Children's Hospital each year. The rapid growth of the Children's Hospital and Pediatric Academic Health Campus as a whole is due in large part to the generous support of Bristol-Myers Squibb.
It was something that was a very, very big deal for Bristol-Myers Squibb for a number of reasons. One is we were thinking about making the largest philanthropic gift in New Jersey that we would have ever made. This would have been the first time in the 125-year history of Bristol-Myers Squibb that we would have actually given the rights of our name over to another organization. It would be the first time that a healthcare/pharmaceutical company was going to put their name on a hospital. As a company whose mission is really to discover and develop new innovative medicines for unmet medical need, we truly understand that medicines are an important part of the solution, but it's only part of the solution. That you actually have to have strong delivery systems. We truly understand what an asset this is to New Jersey, but most importantly to the children.
The Randalls family is one of the thousands who've sought treatment at Bristol-Myers Squibb Children's Hospital. The Randalls' 2 sons, Colin and Sean, were diagnosed with cystic fibrosis at birth. Since their diagnosis, they've entrusted the care of their children to Dr. Thomas Scanlon, Chief of the Division of Pediatric Pulmonology and Cystic Fibrosis.
When you are hospitalized, you want the best and you want the most comfortable setting for your children. And we do travel past 3 other children's hospitals to come here. But it's been the best setting so far. And we've been here for a couple years now and through a couple hospital stays. My oldest, Colin, was hospitalized. He's 8 years old. He was here for his 8th birthday. Sorry. It was a difficult day for us. When I came back from lunch, basically the entire staff of the 5th floor, from top to bottom, walked into his room and sang happy birthday. I get very emotional when it comes to my children because basically my only job is to keep them alive. And As a parent, that's every parent's job. Mine has been made a little more complicated because of cystic fibrosis, but I'm very grateful for the team that I've met here who can assist me and their mother in accomplishing those goals.
As the Bristol-Myers Squibb Children's Hospital marks its 10th anniversary, it remains the focal point of New Brunswick's growing Children's Health Campus, which also includes key partners such as PSE&G Children's Specialized Hospital, Ronald McDonald House of New Brunswick, the Embrace Kids Foundation, and UMDNJ Robert Wood Johnson Medical School's Child Health Institute of New Jersey, a pioneer in pediatric medical research.
The Child Health Institute was created to become the preeminent center for biomedical research to provide new scientific direction to help treat and ultimately cure childhood diseases. And each partner in this alliance has a strength: acute care, ambulatory care, rehabilitation, and now research that's going to allow for not only basic research, but also clinical research, and most importantly, I believe, in the conditions of treating these patients, translational research.
Since its founding, the hospital has amassed an impressive list of milestones and firsts. The hospital took a major step in its growth when it was designated as a regional perinatal center in 2003, giving it the capability to care for the tiniest neonatal babies to adolescent patients. The Bristol-Myers Squibb Children's Hospital would add a brand new neonatal intensive care unit just 2 years later. Auxiliary President Claire Drain and her family were among those who benefited from the skilled, compassionate care of the NICU staff during a difficult time in their lives.
I first became involved with the hospital through the birth of my children, Hope and Elizabeth. I went into preterm labor with them. My doctor at the time that was taking care of me referred me to the high-risk OB group here. And I did deliver them early at 28 weeks. They were in the NICU here for many months. When my daughter Hope passed away here in the hospital, Elizabeth was still here, and those were some very hard days to walk back into the NICU and only have Elizabeth here. Being here, I feel like I am honoring her memory, and that's one of the things that I think is most important for me in my role as the auxiliary president and as my role on the foundation board, is to be able to help people understand. And there are, so many wonderful things that happen here every day. And I am eternally thankful.
The Bristol-Myers Squibb Children's Hospital enjoyed significant growth in the middle part of the decade. The campus added the Child Health Institute of New Jersey, Ronald McDonald House of New Brunswick, and PSE&G Children's Specialized Hospital, the nation's largest provider of pediatric rehabilitative services.
To get to us at Children's Specialized, you really either are coming from a trauma center or an intensive care unit. And so there are very few places that have the skill set of talent of practitioners as well as the infrastructure to be able to care for kids that are that sick. At BMS, we are working hand in hand with the medical school to say, let's look at how we can do recruitment of those top talent together. Children's Specialized treated 18,000 children last year. It is absolutely the place that if you're a clinician, you want to have that opportunity to work on kids. And if you're a researcher, one of the hardest things to do is find kids to be part of your trial. We bring that right to the table, and so we're sitting together thinking about where are the opportunities that we can come and leverage the fastest and the most, and really bring the talent together to be able to work hand in hand so all of us are successful. Our children should be able to stay in state and get their care, and that is our goal and our focus, and together we will achieve that.
It has been an outstanding decade for the Bristol-Myers Squibb Children's Hospital and all of the partners on New Brunswick's Pediatric Academic Health Campus. The spirit of teamwork that exists among all campus partners helps the Bristol-Myers Squibb Children's Hospital write new chapters to its remarkable success story every day. And it's because of this spirit, along with an unyielding commitment to providing exceptional, compassionate care, that all believe the best is yet to come for the Bristol-Myers Squibb Children's Hospital at Robert Wood Johnson University Hospital.